This is Dr. Matthew Ward. I'm going to show you how to use the Syrikit from Aseptikits to fill syringes for intracameral moxifloxacin injection. The Syrikit is cleared by the FDA and can guarantee sterility due to its closed system technique-independent design that is USP 797 compliant. Syrikit contains a pre-sterilized header bag that has been previously filled with 20 pre-capped 1 cc syringes. Filling option 1 will utilize IV moxifloxacin at its concentration of 1.6 milligrams per milliliter. The bag is accessed with a 20 cc syringe on an 18-gauge needle. Once 20 cc's are withdrawn, the Syrikit can be filled immediately. Filling option 2 requires dilution of moxifloxacin eye drops with BSS. The eye drop bottle and the BSS are accessed using a 20 cc syringe and an 18-gauge needle. The needle is inserted directly into the eye drop bottle and the entire contents are withdrawn, 3 cc's of moxifloxacin. The BSS bottle is also accessed and 7 cc's are withdrawn for a total volume of 10 cc's. The external source syringe can then be attached to the filter assembly and filling can begin. The pre-capped 1 cc syringe is brought to the cap removal device and the cap is engaged where it can be removed. The syringe is then transferred to the internal lure slip fitting and the filter is primed. The syringe does not have to be attached for the priming step, and once primed you'll see fluid flowing into the lure slip. When drug is visualized in the lure slip adapter, you can begin filling the first syringe. Each additional syringe is filled using the same technique, where the cap is removed, the syringe is filled, the syringe is recapped, and then set aside to make way for the next syringe. After the last syringe is filled, you will have 20 sterile capped moxifloxacin syringes that can be used for intracameral injection. An internal syringe is provided to collect any excess drug and avoid waste. The header bag can finally be opened and you can be assured that the contents within the syringes are sterile. Here is a live case of moxifloxacin injection at the end of the cataract surgery. This is Dr. Matthew Ward with Riverwoods Eye Center. Thank you very much.